Hi, I'm Dr. Lisa Simpson, President and CEO of Academy Health. Welcome to our Future of HSR interview series. As Academy Health celebrates 40 years advancing health services research and health policy, I wanted to build on that history to look forward at how our field is changing and how we might align our work towards higher impact, more equitable research in the future. In this series, I'll be talking with leaders in health services research, in health policy, and innovation to reflect on where we've been and, more importantly, where we're going next. Today, I'm talking to Dr. Nasim Afsar, the Chief Health Officer at Cerner. Thank you so much for joining me today, Dr. Afsar. I'm excited for our discussion. As you know, we're talking about the future of health services research and how we align our work towards higher impact, more equitable research. Now, as a health system leader, can you talk a little bit about the role of health services research in your work?
Thank you, Lisa, for having me, and I'm very excited to join the group and talk about the role of health services research in my work over the last 15 years. First, on the healthcare delivery side in quality and safety, population health management, and healthcare operations, and more recently as the Chief Health Officer at Cerner. As you know, the goal of any provider and health system is to deliver health and care in an equitable, person-centered way. And that really means that we have to be meeting individuals and our communities where they are, really understanding what they need, not just within the four walls of our clinical settings, but really out in the communities where they work, where they live. And so to be able to really provide that holistic approach to health and care, the role of health services research to truly understand what's impactful, what makes a difference, becomes critical. No one wakes up in the morning and says, I'm going to go to work and deliver inequitable care. But the reality is that we do. So unless we acknowledge that, we own that, we can't move forward. And measurement and robust evaluation of how our technologies are impacting equity in our community are going to be absolutely critical to making sure that we move things forward.
In your current and previous roles, you've actually done a lot to advance telehealth and other things like a hospital at home and other innovations. And in those and other tech innovations, how are you thinking about advancing equity and ensuring community-wide impact?
There's really three things that every leadership team and healthcare delivery system needs to focus on. The first one is make health equity a priority. Secondly, we have to measure, make sure that we are understanding the impact of technologies on our various populations. And the last one is creating clear accountability for performance and making sure that we are delivering and continuing to improve our processes.
So looking ahead, as you think about the biggest opportunities for health services research going forward, what do you think we need to capitalize on? What can we do better?
Yeah, great question, Lisa. In terms of what are the biggest opportunities for health services research moving forward, I think looking at how can we accelerate the pace of relevant research on big data to be able to really improve care and experience is really critical. Let me give you an example. We have at Cerner a learning health network, a group of about 80 plus healthcare delivery systems that have come together and have over 100 million longitudinal patient records. And as part of being in this collaborative, we have a partner that looks at this database and comes to the healthcare delivery systems with groups of their patients that qualify for various clinical trials. So they will come to a healthcare delivery system and say, you have 150 patients who qualify for this cardiovascular trial. You have 5 patients who qualify for this rare diseases trial. Now, here's what's really fascinating about these 85 plus health systems that have come together. They are critical access hospitals. They are community hospitals. They are groups that would have otherwise not had access to clinical trials for their patients. So either the patients would have missed out on groundbreaking therapies, or they would have had to travel 2+ hours. We know more than 70% of US population lives more than 2 hours from an academic medical center. They would have had to travel 2+ hours at a time when they are feeling sick to actually be able to have access to clinical trials. Now, because of this partnership and bringing this group together and leveraging big data, we're able to provide clinical trials for patients in their communities so that they can have access to the same kind of groundbreaking therapies that everyone else should really have access to. I think for us to accelerate the study and evaluation and impact of leveraging big data will really be transformative for the future of health and care as we move forward.